The 26th of September 2024 marked the very welcome commencement of the Patient Safety Act 2023, or to give it its full title, the Patient Safety Notifiable Incidents and Open Disclosure Act 2023. For the first time, it provides for mandatory, as opposed to voluntary, open disclosure of a list of patient safety incidents which may occur during the provision of health services in both public and private settings. It's important to remind ourselves of what the Act aims to achieve. It sets out a list of notifiable incidents that must be disclosed to a patient and/or their family. At present, the list refers to incidents which result in unintended or unanticipated death, although the Minister for Health may add additional incidents to this list in due course. Once a notifiable incident occurs, the health service practitioner, such as a doctor or a nurse, must notify their health service provider as soon as possible. The appropriate regulatory body must also be notified within 7 days. The doctor or nurse responsible for the patient's care must then hold a meeting with the patient and/or a family member so that open disclosure can be made. This meeting should be a comprehensive discussion of the incident and whether any steps need to be taken to address the circumstances giving rise to it. The Act also provides for the making of an apology where appropriate. Importantly, for health service providers and their insurers, the Act provides protection in that any information discussed during the meeting shall not invalidate insurance, constitute an admission of liability, or be admissible as evidence in legal proceedings. It is of note that the Act provides a separate procedure relating to cancer screening services such as cervical check or bowel screen. Patients now have a right to request a review of their results from the cancer screening service, and there is also an obligation on screening services to inform patients of this right. Once the review is carried out, a meeting will be held with the patient to discuss the results. In October 2023, to prepare for the commencement of this Act, the Minister launched a national open disclosure framework, which sets out a system-wide approach for healthcare providers to follow when engaging in open disclosure. A number of preparatory steps were also to be implemented, including the rollout of a training policy to all HSE staff, as well as necessary updates to the National Incident Management System. On World Patient Safety Day, 17th of September, the Minister announced that all preparatory steps had been completed. The HSE have also advised that the new open disclosure training module is now available to all staff. Under the Act, the remit of HIQA will be expanded into certain prescribed private health services and private hospitals. This will allow HIQA to set standards for the operation of these services, to monitor compliance with these standards, and to undertake inspections and investigations as required. This is an important piece of legislation which will play a key role in ensuring that patients have timely access to information. The aim is that the mandatory open disclosure provisions in the Act will contribute to embedding a culture whereby clinicians and the health service as a whole will engage openly, transparently, and compassionately with patients and their families when things go wrong. Healthcare practitioners should ensure they are familiar with their obligations under the Act and should be supported to engage positively with this changing environment. For more information on this new legislation, please contact a member of our medical law team.